everybody, Terry Coutu here with Chamber Chat. This week, I'm speaking with Dr. Rivers Woodward and Dr. Kate Sloss from Blue Ridge Community Health Services right here in Lake Lure. They're going to talk about the COVID vaccine and probably answer some questions you didn't even know you had. We're going to start things out though by giving a little bit of the history of Blue Ridge Health and learning about some of the services they offer. So join us.
I have been here with Blue Ridge Health for the last 5 months, and we are Blue Ridge Health, which is part of a federally qualified community health center. And what that means, as opposed to a private clinic like MAHEC, is that we receive federal funding that gets specifically earmarked to support us taking care of folks who might not have the financial means to, without insurance, to afford seeing a doctor otherwise. And that also allows for folks without insurance for us to provide a sliding scale that becomes much more affordable and discounts both on labs as well as medications, which can be really critical for someone's ability to follow up on care or even take the medicine that we recommend for them. In our clinic, we have Dr. Sloss, myself, and our nurse practitioner, Roland Rogers, who are all seeing patients. And we also have a licensed clinical social worker who sees folks for therapy and counseling. We have access to registered dietitian for nutrition visits via telehealth, as well as our pharmacists who we utilize for additional education and management of things like diabetes. I will let you chime in with
I won't go back the 32 years I've been here, but so many years ago, even before I started working here, there was a rural health center, which is a little different than a federally qualified health center, but there was a rural health center that was set up by the state of North Carolina. And that was up 74 a little ways. It was a little clinic that had been in the old hospital that had previously been an old elementary school. And a lot of people who've been here for a long time remember a lot of the names of the doctors who were there. Dr. Zulik was there. Dr. Birch was actually there in the early years. Dr. Dedman, a whole series of physicians. In 1989, Blue Ridge Health Center took that clinic over, and I started working down there. Several transitions later, partly being part of Pardee Hospital, partly being an independent physician, and partly MAHEC, who built this beautiful building and helped expand the practice. We finally transitioned back to Blue Ridge, which is where we started. And I think that's a great service to the community because, as Dr. Woodward said, there's so much that they can offer as far as ancillary services and support for people who need it. So I'm glad to be back with the Blue Ridge family. And I think it's a great service to the community.
So just to be clear, are there any stipulations about who can utilize your services, or is it open to anyone in the community?
Anyone and everybody. Yeah, I'm trying to think if there's anybody, and I don't think there is. Everybody and anybody is open.
That means we take care of anyone from a 2-month-old to a 100-year-old. And so we do pediatric care, we do well child checks and sports physicals, and as well as do prenatal care if anyone is pregnant in the community and looking for a more local resource. And then we certainly see a lot of folks in this community who are 65 and up and may have a significant number of chronic conditions that need management and evaluation, such as diabetes or atrial fibrillation or heart failure, or COPD, things like that. And those are all things that we manage here as well.
We try to provide, we're not an urgent care. I mean, but we do try to provide that service as much as possible for us to do with the manpower we have. Particularly in the summer, we know that people, fall, people get hurt. So we try to accommodate people who may not be our regular patients, who may need something. We ask for a little patience sometimes because, again, we're seeing our full suit of our primary care patients, and but we do our best. And I think we've done better in the last few years.
So first off, I want to thank you both for joining us today for Chamber Chat. This is a great opportunity for our community to learn more about the COVID vaccine. I'm sure, like myself, you've heard from many people some are excited and they can't wait to get it, and others are a little hesitant. I have to admit, I'm one of those hesitant people. So I thank you for joining us and answering some questions to help us make an informed decision.
Great.
So let's start with the first question. Who can get the vaccine? Which groups are currently eligible here in North Carolina?
So the most up-to-date information, regardless of what you hear on national news outlets and on the internet, the most up-to-date information is to go to the North Carolina Department of Health and Human Services website, which has specific information for the phases in our state. We are currently working our way from healthcare and frontline workers within the healthcare system to over 65, and those folks have been eligible now for a couple months, and hopefully if you're over 65, you've more recently been able to find a spot to get your shot. I know it was very difficult to begin with, as availability of vaccines was quite limited. And since then, in the last couple weeks, the state has opened it up to teachers and staff working in the school system to help in the effort to reopen schools. And then even more recently than that is anyone classified as a frontline worker. And that falls into one of 8 quite general categories, but involves folks like who would be working at the grocery store or in government services, and anyone within those 8 sectors defined on the Department of Health and Human Services website who is having direct contact with individuals through work, so not able to work from home, essentially. And then our understanding, granted, as we are all well aware, recommendations and plans and timelines change on a weekly, if not more frequent basis with COVID. But our understanding is that on the 24th of March is when the phase 4 will start, which includes anyone with one of the defined chronic conditions, which also can be found on the Department of Health and Human Services website, but that will significantly open things up to a large portion of the population around here.
Okay, very good. And just to be clear, each state and local county, there are guidelines that are set out there by the CDC, but they can individually determine how they need to prioritize based on their area. Is that correct?
Yes.
Yeah.
And that makes a lot of sense because different areas have different ability to get the vaccine out. So, if you're in an area that you've already vaccinated all your 65-year-olds, it doesn't make sense to wait till the next phase is officially upon you. So that's why they've allowed that kind of flexibility.
That makes sense.
It adds a little confusion, but still.
So I think a lot of people are wondering, how safe is the vaccine, or who should get it or who shouldn't get it?
Right. So I guess I'll take that one. So the vaccine is very safe. And as a matter of fact, there's been everything in medicine, there's always a little bit of hesitancy to oversell something. And that's kind of been a problem recently with the COVID vaccine, because they'll say, well, we have this data, it's not that much data, but we have a little bit of data, which makes people nervous about the vaccine. We've been doing vaccines in general for years, before I was even born. So we know that vaccines in general are very safe, and there's no reason to believe that the COVID vaccine is not safe. Certainly there are situations, first of all, one of the questions was about the age. Most of them are 18 and up. There's one, and I believe it is I wrote it down, I believe it is the Pfizer vaccine that is also okay for children 16 and up. But the goal is really to get everybody vaccinated. The only issue some people have had, and it's in the press so people know about it, is allergic reactions. We can treat allergic reactions. We do that all the time. When people get vaccinated, we're standing by. There are physicians standing by, ready to provide treatment if someone has an allergic reaction. So there's no reason to hesitate for that reason at all. So most everybody should get the vaccine. It's recommended that other vaccines are not given within 14 days of the COVID vaccine. And that probably is to do with immune responses. You want to make sure your immune system is really focusing on developing immunity to coronavirus. So that's one situation. The other situation is people who have had COVID and were treated with specific treatments. One is monoclonal antibody and one is convalescent plasma. Those people should wait till 90 days. And that's because their immune system has already been sort of suppressed with these treatments, and you want them to be ready to go to react and develop immunity from the vaccine.
Tagging on to what Dr. Sloss said regarding the duration of time for monoclonal antibody treatment. Originally, that was also the recommendation for duration of time from any COVID infection, is to wait 3 months. You can get the shot sooner once you're finished with your quarantine period. However, based on the data we have at this point, you should have quite robust immunity for 3 months following having COVID. And so it's reasonable to wait that whole 3 months and ride out that immunity that you have from a natural infection and then get the vaccination 3 months out, although that's not required to wait that long at this point.
If someone has had COVID already and they had not received the vaccine, how long, when could they get the vaccine? And should they get the vaccine if they've already had COVID?
Yeah, they need to wait till they're done with their quarantine time, which is generally 10 days, unless they're immunocompromised or they had really severe disease, and then it can be a little bit longer. And the reason, and yes, they should get it, and the reason is we don't know how long natural immunity lasts. We have much more confidence in the immunity that you develop from the vaccine. And there have been sporadic cases of people getting coronavirus twice. And unfortunately, the second time tends to be worse. So having had COVID does not exclude you from the vaccine. You just need to wait till you're out of the quarantine time period.
And one of our questions that has come up a few times was regarding pregnant women. And should they be getting the vaccine, or are there certain circumstances where maybe they shouldn't?
Yeah, so like a lot of things right now in relation to COVID and treatments for COVID and the vaccination, the short answer is we don't know, because we don't have a robust amount of data to say for sure. There is no evidence at all to support that it is unsafe to get the vaccine if you are pregnant. And it ends up being an individual decision and a conversation that you should have with your physician. Like any new medicine or new treatment, doing studies in folks who are pregnant is a tough thing to sell and a challenging thing to get good data on. But everything that we have so far indicates that if you're pregnant and you want to receive the vaccine, there should really be nothing stopping you.
So I've had some friends who have gotten the vaccine, and they've talked about a few of the side effects and some of their experience. Nothing too bad. But can you share what some of the side effects are, what the most common side effects are from the vaccine?
Yeah, so they're not unlike the side effects that we're familiar with the flu shot or or really any other of the common vaccines that you might get. I think the one that most people have, or that is most typical, is some pain in the arm where you receive the vaccine. For me personally, it was maybe a little more than I feel with a flu shot. It was definitely sore for a couple of days, but nothing that didn't get better with some movement and just my normal activity a couple of days after. And then very low grade fever and body aches and a headache and feeling a little bit tired is totally normal. I often joke with my patients who I'm talking about this with, because you go to the gym and get a vigorous exercise or really work out a muscle group hard. The next day you're going to be quite sore, and I never hear anyone saying like, oh, my triceps hurt, I'm never going back to the gym. And really what we're doing with the vaccine is giving your immune system a good workout. And so it's natural that and really a good thing in my mind that your immune system is reacting appropriately and having that response, but it does come with some body aches and some tiredness. The one other thing I do want to mention is that your lymph nodes are a very important part of your immune system in terms of upregulating the antibodies and the cells that fight an infection like COVID. And so often after the vaccine, you will have a little bit mild enlargement of your lymph nodes. That is a good thing, but where it can be a little bit problematic is if you have a mammogram scheduled for the week following the vaccine, just because it can be hard to tell, oh, there's a large lymph node, is that from the vaccine or something else? And so the current recommendation is to wait at least 2 weeks after getting your shot before you have your routine mammogram.
And I'll add something else, Terry. Generally, and this, it's like anything that's general, but generally, older folks tend to have less vigorous reaction. Again, most of the people I've talked to in my age group, 65 and over, had very little reaction, whereas I think younger people tend to mount a stronger immune response and tend to have a little bit more, not serious, but have more obvious side effects from having it done.
So there's 3 vaccines currently available out there. Which ones are available in our area?
The first one that came out was the Pfizer BioNTech, and that was the one that everybody knows about because it needed super cold freezer to store it, and very few facilities had it. Pardee Hospital did have that freezer, and they actually apparently planned for this and got one of those so that they could have a super cold vaccine. So those were mostly given to people in healthcare, particularly people associated with the hospitals, since they had the ability to do that. The Moderna vaccine is the most common. It still needs cold temperatures, but it doesn't need the super cold temperatures. Both of these require 2 doses, 21 days between for the Pfizer, 28 for the Moderna. Johnson & Johnson is supposed to be coming out soon. I have not heard, I've asked several times. Community health centers are supposed to be some of the organizations that will get the Johnson & Johnson, but we have not heard yet, unless you've heard something.
I know I've heard of other health systems in the area, such as Mission Hospital, having the J&J shot, and I assume that we will soon, but it is not in our refrigerator as we speak.
Right, and it can be refrigerated versus frozen, which makes it even easier to use, and it's just one dose.
I have gotten a good number of questions about comparing the efficacy between them recently. And, this one is 3% more effective than the other one. So should I wait until fall until I can get the one that's 3% more effective? And really what I've been telling folks is just get whatever shot you are eligible for and you can get your hands on. The Johnson & Johnson one, which a lot of people are excited about because of the ease of storage and the fact that it's only one shot. In the studies, it is slightly less efficacious than the Moderna or the Pfizer, but still more effective than the typical flu shot in a given year. And so it's still quite effective. And the key to this is not so much the numbers for each individual person in the efficacy, but the number of people who we can get a vaccine to of any type, because it's getting all of us somewhat protected or very protected together that's really going to reduce the rates more so than looking at the individual numbers and stressing out too much over that decision. So take whatever shot you can get.
And I think along those same lines, a lot of people are concerned about the new strains that are showing up. And I've had some people say, well, I'm not going to get the vaccine until they tell me that it's going to cover the new strains that are there. And we see that that's a real thing. What's your comment on that?
So far, the strains still seem to be susceptible to the vaccine. That doesn't mean that that won't change, but the vaccine manufacturers and the CDC are all looking at that closely. And if there comes a time where there is a variant that is not susceptible to the vaccine, they will offer a booster to include that. The concern about waiting is that variants occur when people are vaccinated. And when more people are vaccinated, it gives the virus more chance to mutate and change. So waiting until there's more variants out there kind of defeats the purpose of getting as many people vaccinated as possible.
Do people have to pay to get their COVID shot?
There is not. So the vaccination itself is totally funded by the federal government as part of the aid packages and the research that went into developing the COVID vaccine. Depending on where you get a shot, it's possible that there will be a fee associated with the nurse charge to administer it. Although within community health centers and places like that, people are not receiving a bill for receiving the shot.
What locations do we have available near the Lake Lure Chimney Rock area, whether, that are offering the vaccine? I know you guys have been able to offer it at times, and I guess that's kind of a rolling change in who has it and when they have it. So what's available right now that you know of? Keeping in mind that this will probably come out next Monday.
So it'll be all different by then.
It's definitely been a challenge to plan, and there's many more people who are eligible and want the shot than we have spaces. And at least within Blue Ridge Community Health, as well as a lot of the other organizations, we were finding out on a weekly, it's gone back and forth between finding out the number of doses coming to the county per week versus having a little guarantee. So it's been very variable between the weeks, but places that are worth going for more information are Spot My Shot through the North Carolina DHHS website to find a vaccine location close to you. You can go on our website with Blue Ridge Community Health Services and find more information. And for some of our locations, there is an option to put in an email for information about appointments. And then the Walgreens website is another potential resource. And I think that the locations that, so currently in the county, just to reiterate, it's the health department, Blue Ridge Community Health Services in our county that are delivering the vaccine. I'm not aware that any of the retail pharmacies.
The Walgreens in Marion is the closest one that I saw that was offering it.
I know that is coming, but I haven't heard confirmation that the retail pharmacies are also offering it.
So I guess the next question is, I've gone through, I've gotten my vaccine, and I'm all good and safe as much as I can be. What can I do after the vaccine? What should I not do? How should I be careful? What's my limitation?
Yeah, and I'm glad you asked, because it gave me the opportunity to explain the fact that we are sitting next to us and not masked in the same room, which you have a nice face. I don't think that I've seen Dr. Sloss's face really since we started working together, to be honest, given that I'm new in the last year here. But so the current recommendations are being developed as we speak. The CDC just came out within the last 2 days with the recommendation that it is reasonable, if all parties are vaccinated, to gather without masks indoors in the same room. There was also a recommendation I saw around if one person is vaccinated and the other person is within a low risk category, that is also a reasonable setting to engage in unmasked, however, preferentially outdoors, like we've all been getting accustomed to doing, and is much more possible with the weather we've had in the last couple of weeks here. In general, getting the vaccine does not at all mean that you are bulletproof, that you cannot get the infection yourself, or that more concerningly, that you can't pass it on. So there's some concern. We really just don't have the data to say yet that it's possible, even though you don't develop symptoms and get the infection, if you were exposed to a significant amount of the virus in the air. Essentially, it could be lingering in your nostrils or in your throat while your immune system, which is now strong from the vaccine, is cleaning it up. It's not inconceivable that you could pass some of those viral particles on to someone else. And I think the data will be coming on that. We just don't have it yet as to whether the vaccines prevent that type of spread from vaccinated individuals to folks who may not have had the vaccine. And then, of course, keep following the 3 W's: staying and waiting 6 feet apart, wearing your mask,
washing your hands.
and washing your hands.
I was just going to say, for myself, I feel like it sets a good example for me to continue to wear my mask. If I'm going into the grocery store, we have to remember that really a small percentage of the population has been vaccinated at this point. So just that we've been vaccinated, that's great for us. But, if we're walking around, any of us, without masks on, that might send the signal it's okay for everybody to take their masks off. And that's not true, because again, there are people who are vaccine hesitant or aren't taking their vaccine and could be high risk, or people who are still waiting and haven't gotten their vaccine. And if my mask is off, other people may think, well, my mask should be off. So I think it's really important to continue to wear the masks when out in the public. We sort of so quickly have transitioned from COVID to now COVID vaccine. We were spending so much time talking about symptoms of COVID and what you should do for COVID. And we've sort of moved beyond that, but there still are people getting sick with COVID, and there still are people dying from COVID. So I want to make a plug for anybody who is in what's considered a high-risk situation, where if they get COVID, they could get very sick. I know a lot of people get their COVID tests at a drive-through, at CVS, and they don't talk to a provider or to their physician or to anybody. They just say, well, I've got COVID, I'll stay home. Certainly anybody over the age of 65 is eligible for monoclonal antibody. And that has been shown to be very effective prevention for people going on to being sicker. But you have to contact a provider and get that set up. And even people who are overweight, there's a specific cutoff, but those people are high risk and they can get very sick. So I'd really encourage anybody who listens who, gets a positive test to make sure they do check in with their doc or a provider or someone to make sure that they don't need to have some treatments early on, because it has to be within the 10 days of you being diagnosed. So, because I've had a couple of phone calls on day 12 when they might have benefited. So it's still out there too. I would recommend that people just go ahead and bookmark North Carolina Department of Health and Human Services website or the CDC website, because I think the question March 24th is going to be, am I high risk? And I have the list here, but I can't read them all out because there's so many. There are a lot of risk factors. Some, would make sense. Some you might not know about. So I'd recommend people look that up to see if they are considered in the high risk category so that they can start signing up to get the vaccine.